Hello, my name is Audra Delacruz, and I am a registered nurse at the dialysis unit at Baylor Scott & White in Temple, Texas. I am here to speak with you all today about the importance of anemia management in chronic dialysis patients. The Baylor Scott & White outpatient dialysis unit is one of the largest units located in Texas. There is a total of 248 patients here. There are many quality improvement initiatives, but currently the focus is on anemia management. This issue is of great concern to the organization due to undesirable patient outcomes and decreased reimbursement from the Centers for Medicare and Medicaid Services. Baylor Scott & White is a not-for-profit healthcare system who depends on reimbursement from CMS. It is clear anemia management is important to the success of the facility and to the organization, and we need to see improved patient outcomes. Anemia management is a crucial part of caring for our patients. As most dialysis providers are aware of, patients with chronic kidney disease do not make enough erythropoietin. When fewer red blood cells are produced, the patients experience anemia and the undesirable effects of that anemia. Many dialysis patients are also deficient in iron, which is vital and it's needed to produce healthy red blood cells. Patients experience anemia for a considerable amount of time can experience heart disease and have increased risk of death. The main quality indicator used to determine if improvement was needed in the anemia protocol was monthly lab draws and comparison from previous months. Hemoglobin levels, TSAT, and ferritin, also iron, are evaluated each month by the quality manager, nurse manager, and the attending physicians here. This data is then compared with national averages and quality goals set by CMS. Hemoglobin levels are expected to be between 10 and 12 milligrams per deciliter. TSAT target level is between 20 and 50%. The Centers for Medicare and Medicaid Services expectations are less than 30% of patients currently receiving dialysis here to have a hemoglobin less than 10, and that no more than 5% of the population here have a hemoglobin greater than 12. At this point in time, more than the acceptable number of patients are out of range. Monthly labs are the main source of information used to determine if quality improvement is needed and to allow physicians to monitor critical lab values and adjust medications as needed. It is vital that labs are drawn at the correct time. Baylor Scott & White is a Christian organization that values each patient fully, with its mission statement stating that the organization aims to promote the well-being of all individuals, families, and communities. It is of utmost importance to give the best care possible, which includes changing the anemia protocol based on evidence-based research as needed to improve patient outcomes. There is a need for improved hemoglobin levels in our patient population. The goal is to have all patients within the set range for hemoglobin, which is between 10 and 12, within 3 months. These ranges are set forth by the Centers for Medicare and Medicaid Services, who reimburse dialysis units for treatments. It is important to have patient hemoglobin levels within this range for better patient outcomes long term. The data, as you all know, is collected by current staff in the unit to include nurses and patient care technicians who work with patients daily. Through monthly labs ordered by physicians, data is gathered to determine if patients have improved hemoglobin levels. The nurse manager and quality manager then review the lab for each patient and compare them not only to previous labs, but to the Centers of Medicare and Medicaid Services current standards and expectations. A quarterly dialysis facility report is then provided to CMS for review. We as nurses play a major role in helping achieve the initiative and improve hemoglobin levels in our patient population. We interact with patients daily and may be the first to report changes to physicians in patient status. Many patients on dialysis may experience blood loss or may have blood in their stool, which can affect hemoglobin levels. As nurses, we also give prescribed medications such as Epigen and iron. We also need to ensure that labs are being drawn at the correct times and communicate with the lab to make sure that lab tests are processed correctly. There are many challenges Baylor Scott & White Dialysis Unit faces while trying to meet the goal of improved anemia management in hemodialysis patients at Temple Clinic. An ongoing issue affecting anemia management has been missed labs. Monthly labs are scheduled by physicians based on current protocols, and it is imperative that they are drawn at the precise times. Many patient care technicians, as well as nurses, do not complete the labs when ordered. To alleviate the issue of missed labs, the charge nurse on duty should remind each bay nurse of labs scheduled for that day. The bay nurse can then ensure each patient care technician completes the scheduled labs for their assigned patients. Iron is also important in managing anemia. Without enough iron in the body, hemodialysis patients receiving Epigen will not see improvement. It is vital that TSAT levels are above 20%, and this can only be achieved through constant review of hemoglobin and TSAT levels. The floor nurses, nurse managers, and physicians must collaborate to ensure these levels are being evaluated and changes in medications are being completed by the physician. Nurses must communicate with the lab to validate that lab tests are processed correctly and that the critical labs are being noted. A budget has been created to include all labs and medications necessary for anemia management. With the recent federal government's prospective payment system for dialysis care called bundling, the system for dialysis facility must be more conscious of the use of medications and labs before. Therefore, it's imperative that labs are drawn at the correct times and processed correctly. Weekly nursing and staff meetings should be held to discuss obstacles in giving quality care needs. With these modifications in the management of anemia, the facility hopes to improve hemoglobin and TSAT levels in all 248 patients and have them within the designated range within 1 month. Monthly evaluations of labs will determine if the modifications are effective and if extra modification of the quality initiative is needed. Anemia management is an ongoing and extremely important issue among the dialysis patients here at Baylor Scott & White. It needs to be resolved. There are many challenges that hinder obtaining the goals set forth by CMS, but with complete and total effort between nurses, patient care technicians, physicians, and management, and changes in anemia protocol, CMS expectations, and positive patient outcomes can be achieved. Thank you.